You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. We're back at Stellar Success Podcast. I'm your host, Dr. Tudor Franco, and I have a great guest today from all the way on the West Coast, from Seattle, Washington. How are you, Dr. Perez?
Hi, thank you for having me. I'm doing great.
Excellent. Dr. Perez, you are someone who is, I would say, a little bit different profile than most of the physicians I interviewed. So tell us a little bit about your journey. How did you start? Where are you now?
Well, I'm originally from Colombia, from South America. So when I moved to United States in 2001, actually I was here in 010101, January 1st, 2001. I started doing a residency in a hospital. And I decided I was doing residency with oral surgeons. And I really liked oral surgery and doing extractions and that aspect of dentistry. But then I decided to move to the West Coast, to Seattle area. And my journey started changing because I was seeing that my patients, I was doing everything that was taught in dental school and all the experience that I got in the residency. But some of my patients were not really improving. I had a patient that she had a lot of ulcers in her mouth. And with all the knowledge that I had, I was giving her the information of things to do, and she was still not feeling better. The ulcers were not getting better. And later I realized that the problem that she was having was more like systemic. It was just a systemic condition that her immune system was not helping her heal. So I decided I need to have more tools in my toolbox because my job is to help people. And I was not fulfilling that goal. And I started doing research and found a university where I was able to study and do a PhD in integrative medicine. So I started learning more about that connection between the mouth and the body and how the body has a reflection in our mouth of what's going on inside. And we can see a lot of changes in the gums, the buccal mucosa, the tongue. There's a lot of information of what's going on in our body. What are the imbalances? So I learned a lot about traditional Chinese medicine, Ayurveda, and how the nutrition, the microbiome, the bacteria in our mouth and our gut has a big impact in our health. So then I decided to change my conventional dentistry into a more biological, more holistic approach. And that's what I practice right now. So
That's amazing. Yeah,
it's very rewarding too.
It is very rewarding. It's I would say, a new field that people get used to because there's I would say it's a wave of health influencers out there that are promoting this, biological dentistry as a form of, natural treatments, I would say, and not toxic treatments. So you probably know better to describe this. But what I wanted to ask you is, what do you think makes you successful in this?
I feel like a big part of it is passion. Just being passionate about what I do and the desire to help and do my best with my patients. Being persistent and studying a lot, learning a lot, and being curious. I think that's a big part of it. My mind is really curious and I want to learn more and I want to absorb information so I can provide a better service for my patients and to learn even with my own experience, because I have also had my own health struggles where unfortunately I've been through a lot of physicians that, we're all different and we're all respond different to different treatments. And sometimes we need to be our own advocate because we are the ones that know our body the best and what responds better with certain things, what foods are better for me, or what are the exercises that are better for me, or breathing exercises or meditation. So certain things that unfortunately in conventional medicine, some doctors don't recommend that are very important for us. So I think that curiosity and being passionate about what I do is what has been the big part of my success.
Interesting. Do you have any specific skills or habits that you think don't get enough credit for your success?
Habits, I think that, as I said, just being persistent and just trying to do my best and being honest. I like to do, one of the biggest habits that I have is to have a morning routine where I prepare myself for the day, visualizing my day and how my day is going to go. That's something that I really like to do. And meditation is another habit that I started doing about 5-7 years ago. And I feel like when I don't do those, even if it's for a minute or 2 minutes of silence and just being with myself, if I don't do that, it's like my day is not the same. It's not as smooth. And skills, I feel like probably that having that habit is a skill, and detail oriented, especially in dentistry. And now that I'm doing more surgeries and I'm seeing how patients that are struggling with health issues and they go to their dentist and they don't see anything wrong. But then when we go in and take a look at a CBCT, at a CT scan with a 3D image, we can see that there is infections that are hidden, that are not visible with just a regular panoramic X-ray or a PA or like a regular X-ray. So just being detail oriented and removing this abscess or this infection, and also trying to find that root cause of what's causing the problem to the patient. I feel like that's a skill that I have.
That's awesome. I want to get more into the biological aspect of dentistry. This is very exciting to me, and I personally had a lot of experiences in dental work for myself. That years and years ago, I come from a former communist country, so we had limited resources, I would say, and most of the dental work was done by I would say primitive probably methods that are considered now, with lead fillings, with all this like metal in, heavy metals in the mouth and all this stuff. We had no idea at that time. And now we're coming to understand that all those things are actually very toxic to the body. Sitting in the mouth and 24 hours a day, kind of sipping into your bloodstream, so to speak. So, what do you think, from your point of view, with this new biological method? What is the main difference between your approach and a standard dentistry approach?
When we treat a patient, when we see first patient, a new patient, for example, every single one gets a CT scan, a CBCT, because I cannot diagnose if I'm not able to see, right? And that's one of the most important things. Not every conventional dentist is going to take a CBCT scan and do a full mouth evaluation. We also send this CT scan to a radiologist. So we want someone else looking at this CT, because I found that a lot of the patients that have root canal teeth, for example, they have abscesses, they have bone loss around it, they have a big infection. Like yesterday, I had a patient that she was feeling like a lot of inflammation in her body. Her joints were hurting, a lot of symptoms that no one would tell that there is something going on with her mouth. And I look at her, just do an intraoral evaluation, and her teeth look okay. Yes, she has a lot of restorations, but they look okay. The gum tissue looks okay. And then we take a regular X-ray, like the X-ray that the conventional dentist will take, and they don't see, I didn't see anything. As soon as I took a look at the CBCT, there were so many infections under those root canal teeth it explains how her body is not able to heal itself. There is too many fires in her mouth. And then, like, for example, on the sinus, where it's supposed to be that empty cavity where we breathe in and it's full of air, that cortical bone, that bone that surrounds it, it was completely destroyed. There was a perforation because of an infection of a tooth, and it was on both sides. So this patient is going to need to have a lot of work, and her body is going to start having some changes because her immune system is going to stop fighting something that has been fighting for many, many years. So that's one of the first things. The other thing is that we use materials that are more compatible with the body, not as toxic. And for example, if we're removing mercury fillings, those silver fillings, silver amalgam fillings, we use a safe method. So the patient is just breathing oxygen. We make sure that it's completely covered, so all this fumes are not coming out of the body, right? I mean, they're not inhaling it.
Yeah,
So that
that's
we prepare the patient, and we cover and protect ourselves as well. So the assistant and myself, we use a special mask. And a lot of the times you can go and have that removed by a conventional dentist that is not going to have this protection, and you can be okay. You can be fine. But a lot of patients are more sensitive, and all this can cause a bigger impact in their body. And those are the patients that we see a lot. So some of our patients that are very sensitive, they need to have a biocompatibility test and make sure that the materials that we're using are going to be safe for them and they're not going to respond to those. I had patients that they come and say, oh, I just had a filling done. And the next day my face was all swollen. I had pain on my neck from a simple filling. And it's like, it doesn't make sense, but there are patients that are very sensitive.
Yeah, absolutely. And I'm a little puzzled by the fact that currently the dentistry world has to have a standard of care, right? So when you talk about biological approach on dentistry, isn't that supposed to be standard of care?
It is supposed to be standard of care, but
So why
unfortunately,
are people still doing stuff that, we used to do 20, 30 years ago?
that is a very good question. Unfortunately, in dental schools, they're not teaching that. So for me to know what I know right now, I had to go out of my way to learn it. So they're not teaching a lot of the things that are in Europe, for example. Mercury fillings, the amalgam fillings have been banned for many, many years. Fluoride has been banned for many years. But
Yeah, it's a big movement.
yes, we're still
Yeah.
using fluoride. A lot of my colleagues that are not biological dentists, they recommend fluoride
Yeah,
and
I
they
mean, all
apply
the
it.
like look on the market, and I look in the market, and every single toothpaste I can find has fluoride in it.
Correct. Yes. It doesn't make sense.
Why are we so different than Europe in terms of regulations? Like this should be something that we should lead, right, on stuff like this. Like we should have more research done on what the effects of fluoride has, around the body, or mercury, or all this kind of stuff. I do you have any solution for advancing this kind of methods to your community?
I think that what we're doing right now, it's one of the baby steps, just sharing information so people start learning what is it that is necessary for them to be healthy? What is it that they need to avoid? Um, Unfortunately, I feel like a big part of why things are different is it's just related with pharma and money.
Yeah, as always.
And then I don't want to go into that too
Yes,
much
absolutely.
because that will be a
Absolutely.
whole
Yeah,
hour-long conversation.
you fight a monster,
Yes, correct.
basically. Yeah, I agree. And so speaking of this, what kind of solutions do you recommend for, a regular person who comes in and has, several fillings that need to be done, or, regular preventative care, dental care? What do you recommend?
So my recommendation would be to go see a biological dentist.
How do you
Um,
find those people?
Good question. So there is an organization that is called IAOMT, and then you can go to IAOMT.org, and there is a directory of biological dentists throughout all over the world. Um, and that's a good way to find someone local near you. If you have, especially if you have health issues and you're struggling, highly recommended to see a biological dentist because there might be something in your mouth that is triggering some problem, some inflammation in your body. Avoid fluoride. Just is not necessary. There is now better options to remineralize the tooth structure and to prevent decay. And that's with hydroxyapatite. The tooth
Mhm.
structure is made of hydroxyapatite. And there are toothpaste now that has hydroxyapatite. A good concentration is 10%. Dr. Jen's, Jen, it's a good toothpaste that has 10% hydroxyapatite. She actually had to go to Europe to be able to get this concentration because here she was not able to find that. There's some other toothpaste that they don't have the 10% concentration, but they don't use any fluoride and they're still getting the benefit of the hydroxyapatite. Nutrition is really, really critical. They did a study where they show when it was rats that were using for this experiment, they were feeding them sugar and they removed the tooth structure within, I don't remember, it was maybe 30 minutes after they gave them the sugar. They removed the teeth and they were able to see that in the dentinal tubules and these tubules that go from the nerve of the tooth to the outside, they found, because they use an ink, and they found that it was going to the canals. So the nutrition is really, really important. And on my website, I have a blog where it talks about what are the supplements, what are the things and foods that they need to eat on my website, drisabelperez.com. And one of the most important things is vitamin D, vitamin K, supplements like cod liver oil is really good. Vitamin E, vitamin A, those are really, really important. So we need to make sure that we're having good nutrition to be able to have good oral health. And then a lot of the people think that, oh, if I have inflammation in my gums, it's because I just brush or floss too hard. Well, healthy gums, even if you floss too hard, they should not bleed. So then if you're having some bleeding, there is some inflammation going on. And we have some of our patients that they have really immaculate oral hygiene. They come to the appointments at least every 6 months, and they're still having some inflammation. So then that's a sign that there is something going on at the systemic level. And not only that, but we have found, this is another different thing that we do, is that every patient, we get a little sample of their plaque, their dental plaque, and then look under the microscope to see what kind of bacteria they have. Depending on the activity, we can see, okay, this patient has a really high risk of inflammation, periodontal disease, bone loss, or cavities. Or we have found actually amoebas in the mouth. They're not supposed to be in the mouth. So that means that there is a big problem going on with that digestive system. So there is a huge connection with the microflora or the microbiome in the mouth with the microbiome in the gut. So then we can start seeing things that are giving us signs that the body is imbalanced. So we connect a lot with naturopaths or functional medicine doctors to go over these patients that are having an imbalanced microbiome or a lot more inflammation than they should have with the care that they are doing, with the oral care that they're having.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now. Well, yeah, this is another aspect of the treatment that I think it's very important for patients to realize that once they come to you as a biological dentist and you have a different approach, they can't just go home and go to a regular physician or eat whatever they want to eat at home without changing anything. Do you have any kind of referrals that you have and work with physicians that have the same approach as you?
Yes, we do. We do have referrals. They're of course local for patients to go to the area. But if you go online, just look for a naturopath, and then also maybe connecting with those local dentists that are biological dentists and asking them, who do you refer? Because the majority of us refer to naturopaths or functional medicine. And we have a group that is close to our office to make sure that we have a good interaction with our patients. So going to the IAOMT and looking for a local dentist and asking them, who do you refer for naturopath or functional medicine doctor? And that will be the best way to do it.
Interesting. That's good. Another thing that I'm thinking right now is you have all this toothpaste in commerce, right? In the grocery stores. And you look on the back of the thing and it even says that it's toxic for you. So how do you manage a conversation with a patient and comes in and says, but doc, I brush my teeth every night, twice a day with Colgate or with Crest or with whatever, right? And it's the best toothpaste on the market. It's like all inclusive care or whatever they call. How do you manage these conversations?
Well, I tell my patients that the toothpaste is a tool to help your oral health, but then you're not going to be taking high blood pressure medication to help with a stomach ache. So are you using a toothpaste that is not really being beneficial for your general health and maybe a little bit for your teeth? Or do you want to use something that is more beneficial for you, specifically for you, without side effects? So then our recommendations for toothpaste are depending on what the patient needs. For example, if this patient has a lot of bacteria that is aggressive bacteria, I'm going to give this patient something that is going to help manage that bacteria. It's going to kill the aggressive bacteria and it's going to support the good bacteria. And then if the patient is having, for example, a high rate of cavities or demineralization, where you see these whitish spots on your teeth because then the minerals of the enamel are just, they're going away, then I'm going to give this patient a toothpaste that is going to help remineralize this tooth structure. So I'm not giving the patients, oh, you just, whatever you want from the market, and that's what's going to be okay for you. It's not really doing any benefit if you're using something that is a neurotoxin, like the fluoride, or that it has huge amounts of chemicals that are actually going to cause damage on your gum tissue. A lot of the patients that are very aware and sensitive, they use a specific toothpaste and they're going to have irritation in the gums or the tissue, the gum tissue, or the buccal mucosa is going to be irritated. So
Yeah.
we have to be
Forget
aware
about
that
forget
whatever
if they
you're
swallow
using,
it.
or yes, exactly. That's why kids cannot have fluoride toothpaste because they normally kind of swallow it. And they say it's not okay with pregnant women, it's not okay with kids. So why, if it's not okay with these two different groups, is okay with everybody else? And this is something that I ask my patients. Why do you think something that is not safe for a kid or is not safe for a pregnant woman is okay for you? Luckily,
What are
my
some
patients
better
are very
options?
aware. I'm
Yeah.
sorry?
What are some better options you recommend?
So anything without fluoride, and you can even go on Amazon and do a little search, non-fluoride toothpaste. But right now, what I'm seeing with my patients, Dr. Jen's, Jen, is a really good brand. Boca, Boka, it's another good brand. For example, if you're having a lot of bacteria, maybe a lot of inflammation, and it's not improving, Biocidin is another good brand. For a sensitivity, for example, Dr. Jen's can help a lot with sensitivity, but there is a toothpaste that you can find it in the stores. It's Tom's of Maine Rapid Relief. And that one doesn't have any fluoride, and it works really well with the sensitivity. But as I said, you want to use the toothpaste to help your case, to help your mouth, your specific problem. And I'll be
Yeah.
happy if people have questions, they can contact me and I can happily answer the questions and
Well, obviously, yeah,
recommend.
it needs to be a personalized approach here because you probably have to test your mouth for specific bacteria or what kind of flora do you have and what kind of habits, eating habits you have and all this stuff.
Mhm.
Definitely. So let me go back into your journey a little bit. And I want to kind of probe into the fact that, we're talking about success here, but we can't have success without like stumbling upon stuff and
Struggles.
struggles and setbacks and even failures. Do
Yes.
you have any examples in your life that kind
Oh,
of
absolutely.
stuff like this happened and you got up and continue to do whatever you need to do?
Absolutely. Yes, I remember when I was doing my residency in Miami, and I told a patient, I said, "Oh, I'm gonna go to Seattle because that's where I'm gonna be practicing." He's like, "You're gonna move there with your English? So with my accent and all this, people are not gonna understand you." So that was one of them. The other is because I was working with the oral surgery department, they there was a lot of discrimination with women, especially. So the men were the ones that were moving forward and applying for the oral surgery program. But in this oral surgery program, I believe there were 6 men and 2 women, and they were treated really, really hard. So they had to work harder hours. The director of the program was very strict with them. And I noticed that in my personal experience as well. So we had to work extra hard to be able to move forward in that program.
Yeah, you had to break some barriers. We all know that,
Yes,
especially as immigrants.
correct. And then when I decided later in life, when I decided to become a biological dentist, 100%, I had a business partner and we had a business for 17, 18 years, worked together really well. When I told him I just wanted to be a biological dentist and I wanted to do something different and better for our patients, he said, "No, I don't want to do that." So it was very difficult because this business that I had was my baby for this long. But I decided to do my biological dentistry because I feel like this is, as you said, the standard of care. This is what everybody should be practicing, and this is what is going to be, or it is more beneficial for patients. So I had to get out of my baby and leave my baby behind and the patients that I had for all these years, because I was not able to offer them what I thought it was best for them, because my business partner was not in the same wavelength as me. So that was a little difficult as well. And talking to a lot of people, when now that I'm more holistic, a lot of my colleagues that don't follow this path, they just have a lot of doubts in what we're doing, even though you're going to find a lot of research and there is a lot of scientific support of what we're doing. Like discovering now, like even here in Washington State, finally, we are going to be able to see that they're not going to put any fluoride in the water, because that was something else. It is not okay to be ingesting this fluoride, to be having fluoride in the water, having kids, having pregnant women drinking this fluoride in the water. So now they're going to be removing that. But why is that? Why it took so long?
Well,
Because they have done studies now, right?
yes, they have done studies, but don't forget this is a change. People don't react well to a big change, and this is a big change.
Yes.
And I think, it's been documented for many, many years with studies that people, the pregnant women need to have fluoride in their diet to prevent, um, birth defects and all this stuff. So I feel like everything is based on the perception of people of how health should be carried away. And I think, especially in dentistry right now, there's a big movement of like you're doing, of changing the perspective for the patients of like what's correct to be done. And I'm sure there's still stuff that we don't know, or we're gonna find out in 10 years from now that we're doing something wrong right now. But it's a
Exactly.
progress, right? You can't just stay at one point. You have to move forward with science. Um, well, based on what you know right now, and your experience and your studies and your expertise, if you look back on your life, what kind of advice would you give to yourself?
I will tell my 17-year-old me to follow my heart, to follow my passion, and just to believe in myself.
That's good.
Hmm.
That can accomplish a lot of things.
Yes, yes.
I agree. Any projects this year? Are you looking forward to some movements, some things that you want to do? What's exciting you?
We haven't talked about something that I'm really passionate about that goes beyond the physical realm or the body, and is the energetic and the psycho-emotional aspect of what I do. I've been studying a lot about biological decoding and dental decoding, which is something that comes from Europe. There's two doctors, Dr. Hammer and Dr. Christian Bayer. They both have studied their patients and how their psycho-emotional state had an impact in their body. So I'm now starting to do a lot more workshops and webinars to inform people about what it is exactly that the body is trying to communicate. So there is a map in the mouth. So as with the acupuncture, for example, every single tooth is connected to a meridian in the body. This is kind of the energetic channel that goes to an organ or a system. So for example, if we think about an upper left molar, that upper left molar is connected to the breast, for example. And we have seen a lot of cases where women that have root canal teeth with infections, they have had either breast cancer or a tumor removed from their left breast. So there is a huge correlation of what's going on with the tooth and what's going on with that meridian that runs in the body. But not only with that, it's also with that psycho-emotional state. So this French doctor, Dr. Christian Bayers, he started asking, he was a dentist, and he started asking all these questions to his patients is, why are you having cavity on this tooth if you have a completely healthy mouth, really good oral hygiene, but there is on that one surface, you're having this cavity. So he started connecting all the dots with all these patients. And to summarize, it's just every single tooth is not only connected to a meridian, but is also connected to an emotion, to a conflict, to a big impact that the patient had. And then it's giving information of what are those things that we need to heal in our life, not at just the physical level, but at that psycho-emotional level. And it's amazing because I was surprised every time I was asking a question to the patients, like, how's your relationship with your father, for example, when they were having an issue on the upper right side, because that's the connection with the father. And then they start crying. It's like, oh, I'm having a horrible relationship with my father, or I didn't met my father, things like that. It's like, it's very surprising how the mouth and the body has a lot of information for us that we need to start kind of learning what it is exactly that my body is trying to communicate with me. So teaching people about that, I feel like is important. Not only what is it that I need to do, like nutrition wise or care wise, or what are the products that I need to use for my health, but also what is it that you're thinking and how are you handling your emotions, your stress? How is that balance in between your parasympathetic and your sympathetic nervous system? How are those cortisol levels affecting your body? So then we need to go to whatever we are thinking and how we're responding to certain conflicts or emotions are going to eventually affect our body.
Yeah, this is very important. I think that this is an aspect that many people ignore, and we tend in medicine in general we tend to focus on organs, on diseases, on treatment, but
Yes.
it's very little about prevention, and it's very little about the connection between an organ and your brain and your
Mm-hmm.
emotional state, or
Correct.
what happens in your life
Yes.
every day. So I think it's an evolving, I would say, science.
Yes.
And people need to realize that mouth needs to be treated as an organ, because it's something that not only affects everything that goes into your body, but it's a reflection of what's happening in your body.
Correct. Yes.
So I mean, all of what you're doing right now, and I think it's a great specialty. I think many people should look into your research and your practice and the stuff that you're doing and read more about it. And I think a shift needs to happen to change this approach in dentistry. How can people get in touch with you, know more about your doing, anything related to biological dentistry?
The best way will be with my website, drisabelperez.com. And I'm on Instagram as well, Facebook. We're going to be doing workshops with two other doctors, a naturopath and a physical therapist. And we call it Household Medicine Series because we feel that people need to know about this. And the first topic that we're going to be covering is the energy of perimenopause. We're seeing a lot of shifting and a lot of struggles with women that are going through perimenopause. And it's just really important for people to know what can they do, or
Yeah.
what do they need to do, or who do they need to contact to be able to feel well 100%.
Yeah, absolutely.
Mhm.
Well, I wish you good luck, and thank you so much for being over in the show. And I hope we can maybe talk later during the year and see what's new in this chapter.
Thank you so much. Appreciate what you do because this is something very important. People need to know about all this information.
Yeah, absolutely. I appreciate. Thank you.
Thank you so much.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.